you say is most critical right now if we were to talk about improving population health? What role would care coordination play in this specific population that you're speaking of?
Well, great question. And actually, the evidence is pretty clear at this point that care coordination is an effective way to improve healthcare because of the function that you're providing is bringing all domains, all needs together under one plan with one person or one entity that's responsible to make sure that all of the care is integrated and coordinated. So a very, very important function. Most people in the healthcare space will say that everybody deserves a care coordinator. And it actually has been proven for a long time in the cancer community, and that's where patient navigators came from, so that it helped people during their journey with treatment for their cancer. We can't afford to pay for everyone to have a care coordinator, so what, and you might not need the same level or intensity of care coordination, so it's really looking at your population, good old-fashioned population health. Who are the people that we're trying to serve? What are the risks? What are their needs? Stratify those again by low need, moderate, and then high, and then you tailor your care coordination based on what the needs of the population are. So for someone that falls in a middle or moderate category, care coordination could be telephonic, it could be the reminders for upcoming visits, getting somebody on mail-in scripts so they get their prescriptions on a regular basis, as opposed to the population we serve at the top of the triangle, if you will, where it's much more intensive, much more one-on-one. And again, evidence is mounting that care coordination that is focused around the whole person, that brings all providers together under one platform, however that is, electronically, one plan, is effective for reducing costs and improving healthcare. And really, when you look at what's happening across the country, when you're working with the populations that's the most vulnerable, the most challenged with the most complex problems, you're talking about what's called a health home. And that's something that has been put in place with the Affordable Care Act. And that's very similar to what we're doing in Massachusetts right now. And it is classic care coordination.